Good afternoon and thank you for joining us. My name is Tina Thibault and I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Today we're reporting 14 new cases of COVID, 11 of them in the central zone. Our numbers have been staying down and over the weekends, which is good. Still in the low double digits. Our hospitalizations are also coming down. We have currently 43 patients in hospital across the province with 7 people in ICU. And in the last 5 days, we've only had 3 people admitted to the hospital. It was just a few weeks ago when our hospitalizations were way up and going up. The system was feeling a level of pressure and had to postpone some of the elective surgeries. But as our case numbers have come down and the bed situation has stabilized, I'm happy to say that all elective surgeries are back. And I want to thank all of our healthcare teams for being able to do so and manage it accordingly, and CEO Brendan Carr and the work that he's doing. We're helping manage the system and care for those who need medical support. And our vaccine rollout continues to be ahead of schedule. This week we'll have 66,000 needles into arms across the province, with another 80,000 coming in next week. So today, as of today, we have 61% of our population that has at least one shot. We're doing very well, but we need to keep it going. So if you haven't booked your vaccine yet, please do so. We have our second doses starting to go out, those that are over 80 and up, and healthcare workers are getting their second dose, but you can still book that first shot, so please do so. And with that, I'll turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. Yesterday was the 77th anniversary of D-Day, and I want to recognize the contributions of all servicemen and women, past and present, and offer my thanks and appreciation. World War II lasted 5 years and was a time of great sacrifice. And while it was very different from today, I can't help but think that the world is again having to sacrifice a great deal during this pandemic. In the past generations, people have had to do many hard things, and here we are again. For some, this pandemic has stolen loved ones. It's keeping us from seeing those we love and from living our lives without fear of getting sick or making others sick. It has significantly affected the mental, emotional, and financial health of people, communities, provinces, and countries. And I hope we don't have to do these hard things much longer. We are slowly returning to normal, and while this will look different from our normal before COVID-19, it can be markedly better than it's been since March 2020. One of the lessons we've learned in Nova Scotia and been acknowledged globally for is that a steady, cautious approach is best for our collective health and our overall economy. I know many of you are anxious and want us to move faster, reopen more quickly. But slow and cautious means we only have to do this once. It's about continuing to move forward and never having to look back. I certainly hope everyone enjoyed the weather this past weekend. I was with my family on the Halifax waterfront on Saturday evening, and it was very nice to see people out and about again. And by all accounts, it was a busy weekend in stores and on patios. Our enforcement teams have said that for the most part, people and businesses followed the rules. But as excited as we are to see friends and loved ones again, please remember to keep your groups small and consistent. Maintain distance between groups and practice good public health protocols like masking when required and washing your hands. While our cases remain low, there is still COVID activity, especially in HRM. And our testing numbers are not as high as I'd like. I know I sound like a broken record, but testing is critical over the next number of weeks. The more you're out and the more contacts you have, the more often you need to get tested, even if you've had one dose of vaccine. And I heard again today, many people are misunderstanding that they no longer should get tested if they've had one dose of vaccine. That is incorrect. Even if you've had one dose of vaccine, you can still carry the virus and transmit it. So we need people to continue to get tested, even if they've had a single dose of vaccine. I want to address the school cases that we announced yesterday. While some seem surprised by this news, I fully expected it, given that we still have COVID activity. Like other school cases we've seen, people were exposed in the community and there's no sign of transmission in the school. Students, teachers, and staff are out and about in their communities, and the virus is still circulating. but the benefits for children and youth learning in person at school with their peers far outweighs the very low risk of our current COVID activity. Schools have good public health protocols and plans in place, and we have not yet had any substantive transmission in schools. Our first phase of reopening is about safe choices and priorities. We focused on lower risk settings like the outdoors and those that have established protocols and have a significant impact on our physical, mental, and emotional health, like schools. Having children and youth in school whenever safe has been a priority throughout this pandemic. I'm going to switch gears and talk about AstraZeneca vaccine. Last week I said anyone who had a first dose of AstraZeneca could choose which vaccine they got for their first dose. That remains true. But I've also said we'd make sure you had all the necessary information to make an informed decision. There is now a small study showing that a second dose of an mRNA vaccine, so Pfizer or Moderna, after a first dose of AstraZeneca results in a better immune response than 2 doses of AstraZeneca. Based on this emerging evidence and the risk of a rare but serious blood clotting events with the AstraZeneca vaccine, I am now recommending that anyone who got a first dose of AstraZeneca get a second dose with an mRNA vaccine. Ultimately, people can still choose AstraZeneca for their second dose if that's their preference, or if they are unable to use an mRNA vaccine. Over the next day or two, we'll send out the first batch of invitations for people who received a first dose of AstraZeneca to book an appointment for a second dose. The email will contain the information I just talked about, and I encourage you to read through it before you make your decision. The COVID-19 variants are now being named after the Greek alphabet. So the emerging information about the Delta variant, previously known as B.1.617, shows it is more easily transmitted and not as well protected against by 1 dose of vaccine. This is further evidence of how we need to remain cautious until the majority of Nova Scotians are fully vaccinated with 2 doses of vaccine. Phases 1 through 4 of our plan take us through to the summer, when most Nova Scotians will have had a single dose. And so while we can get back to doing many of the things we've had to give up during lockdown, we can't open our doors and throw caution to the wind too early. Until 75% of our population is fully, that means 2-dose, vaccinated, there is still a risk that can be balanced by everyone following some level of restrictions, good public health measures, continued testing, and getting vaccinated. A few weeks ago, I asked Nova Scotians to lock arms, stay strong, and roar back against the third wave. And boy, did you ever. Your collective efforts in following restrictions and protocols and getting vaccinated allowed us to bring the virus back under control faster than I even hoped for. So thank you to everyone for this, but I do need to ask for your caution and patience as we move through our reopening phases. As I said yesterday, being the tortoise among hares in this race to a new normal is good for our collective health and economy.
Thank you, Dr. Strang. Just a reminder, we'll take 1 question and 1 follow-up from reporters on the phone in the allotted time that we have for today's briefing. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, a month ago, Nova Scotia reported 227 new COVID cases in one day. Today, we obviously reported 14 new cases. It appears we're flattening the curve. Are we doing better than you expected the province would be doing right now? Are we almost out of the third wave at this point?
So as I just said in my remarks, yeah, the timeline in which we've been able to bring the curve down has exceeded even what I expected we could do. So, and that is credit to all Nova Scotians and all their efforts, both in terms of adhering to public health restrictions and getting vaccinated. We are at the tail end of the third wave, but especially with the Delta variant, there's still some risks out there that we need to have a level of caution until we get high coverage with 2-dose vaccine, which will be at the end of the summer into early September.
Go ahead, Natasha, with your follow-up.
Thank you. Also, I guess it could be for either the Premier or Dr. Strang. We are obviously in the first phase of the 5-phase reopening plan. If our numbers keep trending downward, are we still expected to move into phase 2 next week?
Yeah, that's the plan. As we said in the last briefing, our numbers continue to exceed our expectations. It's good to see our numbers stay low, so there's no reason why we shouldn't be able to open on schedule for that 2-week separation between phases, which puts us at June 16th.
Next, we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Thanks very much. My first question is for Dr. Strang. With airport testing starting tomorrow, I wonder why it's not mandatory for travelers, and for travelers who have to get tested during their isolation, like rotational workers, whether that test at the airport will count as their first mandatory test.
So the first question, other than a few streams like rotational workers, we've never made testing for people entering the province mandatory. So we didn't feel we needed to do that for just because we're changing the site at where testing happens. And yes, absolutely, for those who are required, like rotational workers, to have a series of tests, if they get tested at the airport, that will count as their test at entry into Nova Scotia.
Go ahead, Elizabeth, with your follow-up.
Thank you. And next, I just wanted to ask if we've had any confirmed or presumptive cases of the Delta variant in Nova Scotia, and would we be able to test and detect it even if it were here?
So yes, we've had 2 cases, which happened several weeks ago, actually, in people who had traveled outside of the country. They were quarantining at the time they were tested, and they were testing under their appropriate protocol. There was no further spread from these from those cases. We continue to screen our samples at the lab based on the history from public health and submitting samples through to the national lab. And at this point, we've had no further detections of that Delta variant. But certainly we know that is becoming a greater percentage of the variants that is occurring in other provinces.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Thank you. This question is for Dr. Strang, and I'm trying to understand the rationale for it, because you and the Premier have said repeatedly that schools are the best place for Nova Scotia's children to be, and to my knowledge, there has not been any documented case of transmission of COVID-19 through touch. So here's my question. Why are we closing schools when there are cases identified at those schools, and why is there a need for deep cleaning in light of the fact that this isn't transmissible or hasn't been transmitted by touch?
So it's not that there is certainly, we have to be aware of the potential. It's lower risk as we learn more about the virus, but certainly what we call, the surfaces can be part of the transmission. Our approach with schools since September is always to have a healthy dose of caution. So if we have a case in a school and we do the contact tracing and identify whether there's other staff members or people within a classroom that meet the public health definition of a close contact, all those individuals are isolated and tested, and they have to stay isolated for 14 days. But we've always then said we're going to close. One of the reasons we close the school generally for 3 days is we want to get the test results back from all those close contacts. Because as you can imagine, if there were subsequent cases in a number of close contacts, that's more concerning than if we had no cases coming back from our close contacts. And while we have the schools closed for that primary purpose, it also makes sense just to go in and make sure that there's a good, thorough cleaning of all the surfaces as well.
Go ahead, Jean, with your follow-up.
All right, if we follow that logic, Dr. Strang, there have been a number of grocery stores identified as potential exposure sites, notably Queen Street Sobeys in Halifax and the Atlantic Superstore on Joe Howe, and both of them have come up repeatedly. Why have they not been closed for this deep cleaning if schools have to be?
Many of our exposure sites do actually close and do some cleaning. A lot of them also have ongoing cleaning protocols as well that are part of their reopening plan built a year ago, or for businesses that never close, like the grocery stores. They've always had thorough cleaning protocols that's helped allow them to remain open.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Dr. Strang. In regards to AstraZeneca, with your recommendation, does anything essentially change for anybody who got an original shot of AstraZeneca? In other words, before they had this choice looming, they still have a choice. Now I presume they just have your advice on top of that. Is that what my understanding? Is that understanding correct?
Yeah, they still absolutely have the choice. We're just revising our informed consent process, the message that's going to go out as we push out the email for asking people to rebook their second dose. With the latest evidence that became public on Friday, I felt there was enough that for me to give a clear recommendation to Nova Scotians. But ultimately, people still maintain that ability to make a choice.
Go ahead, Keith, with your follow-up.
And with the schools and the variant that's there, especially the Delta variant, I'm still wondering why, in the end, you decided with just a month to go. I understand the rationale for why kids should be in school, but there was only a month to go, and we're in a reopening process. Aren't we risking falling backwards at some point if this takes hold?
So, I mean, first of all, our epidemiology was very clear that we go back to basics. What's our priority? Have children and youth in schools wherever that's safe. I'm puzzled a bit by people saying, oh, it's just a month. We wouldn't throw away a month of school if it was February or November. There's still a lot of learning that can happen in June, and we know that the best place for learning for children and youth is in school.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang, and to continue on the AstraZeneca recommendation. Now, given your recommendation, we likely won't be using much of our remaining AstraZeneca supply. I'm just wondering, is this going to have an impact on our vaccine planning and rollout, especially given the lapses in the supply of Moderna?
No, we have very secure and robust supplies of Pfizer vaccine. We're only talking about at the most 2,000 doses of AstraZeneca. So if the vast majority of those shift to Pfizer vaccine, we absolutely have sufficient supply to accommodate them and not slow down our progress for all Nova Scotians.
Go ahead with your follow-up.
Thanks. This again for Dr. Strang. You just said that you remain concerned about the low testing numbers, and I was at a clinic on Saturday. I was the only person there. Just wondering about the level of your concern that we're missing cases because people seem to be not going in the numbers that we've seen previously.
I mean, that's always a risk. That's one of the reasons we need to have increased testing volumes. Our percent positivity of our tests, though, remains very low, which is encouraging. Today, it was 0.2% of our tests that were tested were positive. So that's helpful, but that's always one of the concerns: is that are we missing something? And again, we absolutely need more people tested, because what that does is to have a stronger confidence in what level of virus that we have around. So it's critically important as we're looking over the next week to make decisions about when we open to the next phase, and even phase 3 and 4 after that. It's critically important that we have high testing volumes, because that's very important information to give us confidence that we're around the safety of where we're at with COVID.
Next, we'll go to André Blanc, Radio-Canada. Go ahead, Adrian.
Thank you. Dr. Strang, all businesses are right now invited to participate to the Workplace Rapid Testing Program. 200 businesses in Nova Scotia have already signed up, and the province is a partner of this program. To your knowledge, do we have enough test kits, and could all eligible businesses implement rapid testing in the workplace?
Yeah, we continue to work, and we'll have more to say on this, like in the days ahead. We continue to work with a number of businesses. The federal government is a partner in this, and they're the ones supplying the test kits. And we have no concerns at this point in time around an ongoing supply of these rapid test kits through the federal government.
Go ahead with your follow-up, Adrian.
In your opinion, should it be left to the employee to decide if and how often they should be tested on the workplace?
So yeah, I mean, ultimately we say to Nova Scotians that the greater the number of contacts in you, whether it's at work or your social life, the more frequent you're in contact with different people, the more frequently you've been tested. But ultimately, people have to make that decision and choice for themselves.
Next, we'll go to Madeleine Bissot from allnovascotia.com. Go ahead, Madeleine.
Thanks. This question for Dr. Strang. You've talked about modified isolation requirements for people from outside the region. When will those be released, and when will we see them?
So again, that we're looking at that. The timing of that depends on our vaccine coverage here in the province, depends on our epidemiology. One of the critical factors that has to be part of that is what do we have a process in place that allows a validation of proof of vaccination. We don't have that yet. We have a specific solution for rotational workers, but across the country, there's still lots of work going on to provide this kind of validation of vaccination. And until we have that in place, it makes it challenging to be able to safely reduce restrictions on people just because of their vaccination status. We need to have process that they can and that one that we can trust that actually proves that they have had 1 or 2 doses of vaccine.
Go ahead, Madeleine, with your follow-up.
And you kind of mentioned this in your answer, but will proof of 2 doses be enough to scrap the need for 2-week isolation requirements?
Well, we're looking at, I mean, that's what we've started with rotational workers. So we've set the template. It's just for broad other streams of travelers, if you will, and then the broad public. We need work to be done to get those solutions in place for proof of vaccination.
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. Dr. Strang, I appreciate your recommendation on AstraZeneca. It's causing some confusion out there on social media right now, but I'll take it for what it is. And you have said that there's only 2,000 doses that if everyone switched and went to the mRNA. So I'm just going to ask again what I asked last week. It's only 2,000 doses, but will that 2,000 doses go completely to waste, or is there a way to get it to some jurisdiction? There's places in Africa and Asia that are in desperate need of vaccine, and is there any way we can help them?
No, and this is an issue across the country. Once it's at the front line, if you will, we've already talked to the federal government. There is no process for us to return that vaccine once it's out on the front line. So, and other provinces are facing the same issue with very low demand for the AstraZeneca vaccine. Unfortunately, it may well expire by the end of June. But we do have vaccine for those folks who are going to get an email in the coming days. We do have AstraZeneca vaccine if that's what their choice is. And we do have the ability to get additional vaccine with a longer shelf life for if people are still looking to get their second dose with AstraZeneca in July or August. We'll give people the choice, and we will have the ability to get AstraZeneca for them.
Go ahead with your follow-up, Tim.
Yes, with the third wave, the numbers were so large that it's completely understandable that the province stopped reporting causes of each case, and you're back to that now. The other thing that was dropped during that process was the number of variant cases. And I'm wondering if we might get back to reporting that to the public.
So we are doing that as we get the testing results in. Quite frankly, what we have commonly is across the country is now the Alpha variant, and so it's reporting that really doesn't make much of a difference. What we're focused on now is any new variants. The most latest one being the Delta variant that we would look to. We would certainly be reporting that if we get confirmation from the national lab.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. I'm wondering about the reopening plan. We've listed kind of what the exact dates are now, hopefully, for each phase, and we've listed what the vaccination levels hopefully have to be. But I'm wondering if, Dr. Strang, you could give more detail about what case numbers we're looking for to move to the next phase. Are we doing well currently, looking forward to moving to each phase? Is it 1 or 2 cases a day? Is 10 cases a day, 12 okay? What's your opinion on that?
So as I've said repeatedly at this table, it's not just the case number. It's the number of cases that we have, along with other metrics. What's we call a rolling 7-day average of our trend? Is that average number of cases trending still continue to trend downward, or is it stable? What's the average number of contacts per case? What's the percent positivity of our tests, and what's the volume of testing? What is our hospitalizations looking like? So it's a number of things we look at, as well as the context of each case. Now we're now able to do intensive investigations of all our cases again, and that's very important information as I talk with my medical officer of health team every day, and what they're seeing as public health investigates cases. That's the qualitative side of this, which is equally important to the quantitative side. So it's far more complex than just a single number.
Go ahead, Victoria, with your follow-up.
Thanks. And I'm wondering about the airport testing. I hope I'm not repeating, as I missed a few days last week. But the tests are self-administered. I'm wondering why they're not being done by professionals at the airport. Is it just a HR, resources issue? And also with those self-administered tests, people are being asked to bring themselves to a PAC to be dropped off. Does that require and encourage people to leave isolation? Do you worry that that's a problem?
So first thing, self-administered, one of the keys, even there's lots of jurisdictions are now moving in and implementing self-administered tests. It does greatly reduce the human resource requirement, and one of the significant challenges we had standing something up at the airport was who was actually going to be the tester. But to do self-administered tests, it's taken some time. You actually have to come validate those type of tests and make sure you're going to get accurate results. And also part of it is, so people will take their own, during most hours at the airport, there will be people there that can assist people for late hours, and when there's low volumes, they'll take a test and take it home. And they will have to drop it off. They could get somebody to drop it off for them, or if necessary, if they have to come out of isolation, do it safely. We still, other people who are in isolation have to come out safely and to go get a test for other reasons. So I'm not concerned about the people potentially having to come out. They could easily drop off a test at a PAC without coming in close contact with anybody.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Thank you. This question's for Dr. Strang. There seems to be quite a lot of youth, 12 plus, from Fall River and East Hants area booking appointments to get vaccinated. What are your thoughts on these youth being so eager to do their part?
Well, I thank them. I'm glad to hear that, Pat. Thanks for bringing that forward. I hope that trend is across the province, and I think it is. With the data I saw this morning, we have a very good uptake amongst the 12 to 18-year-olds with our vaccine, and so that's really encouraging. And it's important that everybody's eligible to get a vaccine. If they don't yet have an appointment for their first dose, make an appointment. We have lots of space, lots of vaccine available. It's also equally important, and I think this is a key message, that people of all ages, as we're starting to open up for second dose, it's just as important to get your second dose as it was for your first dose. We can't relax on this front just because we're starting to reopen up, and we don't perhaps have the fear and the pressure of lots of virus around us to give us incentive. We need everybody to get the 2 doses.
Go ahead, Pat, with your follow-up.
This is also for Dr. Strang. With the testing numbers low, has people become fatigued with testing? And if so, how do we increase it?
I think there is some of that fatigue. As we reopen, people's lives become busier. Probably people were enjoying the weekend and didn't think to get tested. But it's critically important that through briefings, we do all sorts of communication through social media. We ask people to encourage their family, their friends to get tested. Set an example. Get tested. Post it on your personal social media. Make it part of our norm that at least for the next few months that all of us build in regular testing as part of our ongoing commitment to do what's necessary to make ourselves COVID safe and keep each other safe as we reopen.
Next, we'll go to Chelsea Gould from Truro News. Go ahead, Chelsea.
Thank you. This question's for Dr. Strang. On letting travelers with 2 doses enter without self-isolating down the road, would children under 12 be exempt from this requirement since they can't be vaccinated at the moment?
Yeah, there's national discussions around that. We're looking at that ourselves of how do you accommodate a family around that when you have kids who couldn't themselves get immunized by age. But we have made no final decisions. But what we're looking at is treating the whole family as a unit. So as we get to that point when we're actually going to open for that, we'll have much more clarity on that.
Go ahead with your follow-up, Chelsea.
Okay, thank you. I'm also wondering about daily case counts, which lots of Nova Scotians wait for. They're released publicly at inconsistent times each day. Could you perhaps explain why it's a different time each day and if the time frame captures the previous day's completed tests?
So some of it is just getting the epidemiology through, and then there's various levels of approval that have to go through. People like myself, the Premier, we need to see those numbers first, and then production and approval of a release. I would encourage people, it's not so much to focus on any one day, but what's the trend over time that we're seeing. That's the most important thing. Are we seeing a consistent trend over time, not what's any one day shows us? We're going to have fluctuations up and down, and I fully expect we're going to get cases in the teens, maybe even the 20s for weeks to come. That doesn't necessarily mean that that things are going backwards or that it's, as I said earlier, it's all about the context. So while I get people wanting to know the daily case count, there's a lot more to it than that, and think about how things have gone over a week, for instance, rather than focusing on one single day.
That's all the time we have for questions. Go ahead, Premier.
Thank you. And just to conclude today, Dr. Strang and I talked a lot about testing and the importance of making testing a regular part of your routine. We are concerned about the lower level of testing this weekend, especially when the socializing has increased and the weather is getting better. Patios are open, and it's perfectly fine to get out and see your friends and enjoy a patio, support local. No one is doing anything wrong. You can still have fun by following the rules, but testing needs to be part of your routine. If you believe that because you have 1 dose of vaccine that you don't need to get tested, that's not the case. The variants are out there, and they are just as aggressive. The latest, the Delta variant, is causing a level of chaos in other jurisdictions in the world and is climbing in percentages of cases in other provinces. The UK was ready to reopen its economy fully, but the Delta variant has infected people even after the first dose of vaccine. We can't let that happen here. It's why we are encouraging everyone to get their vaccine, which gives some protection, but you still need better protection with that second dose. We can't become complacent. Please keep testing part of your routine. Drop in for a rapid test. It's quick and easy, and we need you to do that even if you're just socializing with people outside. I want to thank all of our healthcare workers and volunteers that are working at these pop-up sites and the PCR sites for testing. We couldn't have done this without you, the level of testing that we were able to do over the course of time in our province. So thank you all. So everyone get tested this week, and if all goes well this week, we can start to ease into phase 2 next week.